Welcome to Frontline. Today I bring you the story of frontline workers who are doing contact tracing, as well as doctors and nurses who have come in contact with a case now confirmed positive at the Korle Bu Teaching Hospital. It looks like all of them will have to be quarantined and tested. Contact tracing is essentially identifying or tracing people who may have come into contact with someone proven or tested to have been positive to have been infected with coronavirus. A number of those people in Wejakbawe are doing a great job putting themselves at risk to help trace people who may have been infected with that virus. Head of our health desk, Fred Smith, has been talking to some of them.
Municipality that started on last Tuesday, and currently we deployed 39 teams to the field, and we have 14 electoral areas. So what we're doing is that we're working currently in 6 electoral areas. We started on Tuesday. We're finishing these 6 electoral areas today, and we'll move to the other areas. We're using 10 days to do the testing for the whole municipality. And what I can say is that it's going well, though sometimes the logistics, we don't receive them on time. But so far, so good. Because when we started on Tuesday, we deployed 22 teams. We had all the logistics and then they moved to the field. Yesterday, we had 38 teams. And then they also had a risk. But today, I think the logistics came in late and we were left with some few nose masks to be given to the teams. But that's at 12 o'clock, they've all left for the field. And today we are deploying 39 teams to 6 electoral areas. And just as I said, we are doing mop-up for today, and then tomorrow we'll move to the other electoral areas.
I see. The issue of logistics keeps coming up everywhere you go. How, in your own way, are you trying to resolve it so that we're able to deploy the officers or the field officers on time, and to be sure that we're able to meet the timelines that we've set for ourselves?
Thank you very much. For the items that we can procure within the municipality, quickly, just as the nose masks, when I met with this, I told you we're going for some nose masks for the team. And most of them comes from their store, from the regional stores. And then what we're doing is that before 8 o'clock, they need to receive all the items. And just as I said, from Tuesday, Wednesday, the items came. Some came late, but by 12 o'clock, they were off to the field. It's only today that I think we were short of the nose mask. And then assembly quickly had to go and then procure some for them so that they can be on the field. And then what we are also doing is that anytime there's a need for anything, we quickly try as much as possible to support them to be able to do the task as is expected of them.
Apart from the protective gear, do you also need some other things, say vehicles or other logistics, to help with what you're doing?
Yes, for vehicles, we are for the 32 teams, we are using only 6 bus, 1 bus, and then 6 pickups. If we're to have about 10 or 15, I believe, because some of what we're doing is that the vehicles will take some, drop them and come back, so it even delays. If we're able to start early, we'll be able to cover a lot of people. But because we have only few vehicles conveying this light team, they have to go and then come back picking them, and it delays the process. And then we also need fuel. We need to motivate the staff to be able to do it. But now they all understand. We've spoken to them. We've told the team, the members, we've told them that it's difficult times. So they're all sacrificing, but sometimes they come very hungry and thirsty. So we're trying to find some support for them. Assembly is trying to find support, giving them lunch, water every day for them to be able to do it for us, because everybody should be on board.
What's the population of this area we're covering?
We're looking at 127,000.
So what message do you have for all of these 127,000 people who will be approached for contact tracing or testing?
Thank you. Before we even went to the field, we had to do some announcement within the communities. Those who have the CIC, Community Information Centers, We sent the information to them. We gave them the pen drive to also blow the information. We invited the chiefs and the imams, though they are not, they don't gather the people, but they have ways of communicating to their people, and they also inform them about it. So they also send them, disseminated the information to the people. But now what I'm also entreating the residents of Wejabawe is that we are lucky to have this facility. It's not all the municipality that has this opportunity to test everybody within them, because if you are negative, they educate you as what to do so that you don't contract it. And if you are positive, quickly they have to manage. You have to manage. They treat you and then help you to manage it. So if you don't know, that is where it becomes a problem. So every resident within Wejabawe, take this the advantage of this opportunity, get tested, know your status, and know what you have to do. And if we are all able to do this, I believe we will not get to the stage where we even have to go through the lockdown. Now we don't even know when government is going to lift up the ban, but we all adhere to the protocols and then also allow ourselves to be tested. Within the shortest possible time, we go back and
We're still on the frontline segment, and you've heard from those who were involved in contact tracing today about logistics. I'm taking you to Korle Bu Teaching Hospital now. We've cited a letter written by the Department of Accident and Emergency Doctors. It is addressed to the head of department and the frontline workers there who may have come in contact with the first case to be recorded there say they were informed only 24 hours after the case was confirmed as positive. We'll be trying to get some of them to speak to us, but of course in these cases it's very difficult to reach to speak. But I'll read to you excerpts of the letter before we take an appeal by doctors urging you to stay home here on Frontline. It says that we wish to express our general dissatisfaction with the preparedness or lack thereof of the department to combat the current COVID-19. Then they go on to say that although this is an existential threat, the case, like most other suspected cases that they have seen so far, was isolated at the side ward at Yellow, a situation they have complained severally about. They say that ward is not ideal for isolating patients, potential cases, and because it exposes both patients and nurses to infection. They also talk about the fact that they were told only 24 hours after the case has been confirmed. They were also not told about it earlier. The letter goes on to say that we have also had to rely on information given to us by members of other departments of the hospital. To compound this, the frontline personnel who saw the case were only informed about the positive result 24 hours after the test had come back as positive. I bring you an appeal being made by doctors, by the way. But let me go on the line and speak to Dr. Bayo, Dr. Titus Bayo. He's a Deputy General Secretary of the Ghana Medical Association. Doc, thank you so much this afternoon. And let me start by saying here on Frontline, on this particular show, all we do is celebrate people who are risking it all to help with this situation.
Thank you for having me, and thank you for the efforts to celebrate the dedication and hard work of doctors and health workers in general in this very difficult time.
Right. So as part of celebrating you, this afternoon before we came on air, we understand that there is a situation that some of the doctors at the Department of Emergency at Korle Bu Teaching Hospital are unhappy about. They say that there is the first recorded case, but those who may have come into contact with this case were only told about the positive results 24 hours after that. What do you know about this case?
I don't have the full details of this case, but I am not surprised because the GMA has had cause to make some complaints about this at some of our meetings to the teams managing and the protocols for reporting cases, that it needed to be reviewed, because I don't think this is the first time we are hearing of something like this, if it is true. Because there have been cases where doctors have been sitting with patients waiting for confirmed results, only to hear of it either in the news or to have closed and gone home before later being called back that the results was indeed positive. And it is because of the protocols involved in the reporting, which we have cause to ask that they really need to review it. Because if it is so, then it's very, very, very unfortunate. I'm not very much appraised with the Korle Bu particular case, but I think if it is so, I won't be very surprised because we've had concerns to complain about this.
And having spoken about that, what sort of stories do your colleagues share with you on a daily basis since COVID-19? What have their experiences been?
Okay, so some of the experiences are basically the lack of PPE. And I think, again, it is one of the complaints we took to the Interministerial Committee and took to the government team. And that's why when they launched the number 311, if you remember, I think the Minister of Information said people who have complaints about PPE is not reaching them should call that to give a feedback. Because we keep hearing government saying they have given out PPEs, they've distributed PPEs, but at the front line, where the action is really needed, these PPEs seem not to be getting there. So we do not know how to reconcile the two. We have people sending us messages across the country where sometimes you go to an entire unit and they are just giving one box of masks, which means that it cannot, it will not be enough for the people on duty at that time.
Right.
In some instances, people have to come to work, roam around asking for masks, just surgical masks, not even the N95, which is the recommended one when you are dealing with COVID-19. So these are I've had hospitals from the Upper West, from the Upper East complaining as of yesterday. Some of them, the whole district hospital or some the polyclinic, PPEs, they are woefully inadequate. So I think those are some of the complaints we have gotten. And I think these are very disturbing. And it was the reason why the ministry launched that number, so that people can give direct feedback.
Okay. Right, Dr. Bayo, what we would do here on the show is to continue to highlight these issues and get government to respond. But for us, one of the things we want to do is to encourage these people who are going the extra mile in these difficult times to keep at it, even as we look for solutions to all these problems that they raise. So if any of them have any interesting stories we can share as we go along here on this segment, we hope to do it as often as possible so we can highlight the good work that they're doing on the ground. Doc, thank you so much.
I don't know, but I would say that we appreciate this effort very much. There are certainly very trying and very good stories of people improvising, doing their very best to deal with the situation with the little they have. The honest truth, however, is that when it comes to PPE, they are as essential as life when it comes to this condition.
All right.
And so it is something people cannot innovate when it is not there, because it will be putting your very life at risk. So we are hopeful that stories like this will call all those in management to sit up and take innovative decisions and take practical measures to protect the frontline health worker, nurses, doctors, everybody. Because if these very people get sick, then our battle against COVID-19 is at risk.
Right.
Thank you.
Thank you, Dr. Bayo. Dr. Titus Bayo is Deputy General Secretary of the Ghana Medical Association. This is the Frontline on the Pulse. I'm going to talk to you about some goodwill messages that some of my colleagues are bringing your way. If you work in any hospital, if you work within the security agencies and you are exposed to people, you don't know your fate as far as contracting the disease is concerned. But before that, I bring you an appeal by doctors asking you to stay at home. So the whole world has issues with PPEs. America is complaining. Italy has had to get help from China. China itself had its own issues earlier on. So for those of you at the front line, those of you at the front line were saying thank you. And for those of you at home, this is what the doctors want you to know. And on to some goodwill messages from some of my colleagues here at Multimedia.
It's Lexus Bill, host of Drive Time on Joy FM. Now, one of my favorite quotes is from Ralph Emerson. He says, "To know that even one life breathed easier because you lived, that is to have succeeded." And this is a very special message to our frontline health workers who are working so hard to make sure we breathe easier, to make sure that we live a comfortable life. In these times, we say kudos and thank you so much. We actually are grateful eternally to all our frontline staff, our doctors, nurses, our policemen, our officials, as well our military men who are ensuring that we're staying at home. All of you are our heroes. God bless you and thank you so much for all that you're doing for Ghana. God bless you.
Hello everyone, my name is Nathaniel Atto, a journalist who is the son of a medical doctor and brother to a medical doctor. Over the years, I've had a fair appreciation of what not only medical doctors but all health professionals go through on a daily basis in the theaters, in the consulting rooms, and of course, in the wards. During this period that COVID-19 is threatening our very existence as a people, we would like to say a very, very big word of encouragement to all health professionals who have put themselves in the front line to battle this rather unfortunate spread of COVID-19. To every single health professional, I say thumbs up, keep up the good work, and we pray that together, as we all support you, all of this will come to an end. My name is Nathaniel Atto, and I like to say thumbs up to every single health professional at the front line of all of this.
And some of you have been sending in WhatsApp messages to us congratulating and supporting all these health workers or other people who are at the front line. Before I bring you that as we end, Multipack Company Limited is a producer of 5-star energy drink and Pella water. They've donated some items as well to the Ghana Police Service to help fight against the spread of coronavirus in the country. The sales and marketing manager of Multipack Limited, Rabia Boji, said the items are to augment the supplies of the Ghana Police Service in a bid to, enforce the lockdown so we help curb the spread of COVID-19. But thank you so much to that company that's helping make the life of those who are at the front lines a bit easier. Like I said, I'll end Frontline today with these messages that some of you have been sharing with us in a bid to encourage those who are working for all of us.